My body is numb. I cannot feel anything. Even if I bumped into something, I wouldn't know it. Sometimes I even see my foot bleeding. I don't even know what hit it because I cannot feel anything. I think my body is already dead. Even if I cut myself, I wouldn't feel it. I have a very big wound that doesn't heal at all. This used to be really very big. Now, it has improved a lot. The wound used to be very deep.
Our patient Mr. Dimas is a carpenter for so many years. So he is exposed to paints, thinners, cement, and chemicals in wood. Carpenters and construction workers therefore are exposed to so many chemicals that are detrimental to health. When these people work, they perspire so that the pores in their skin become open, making it easy for the chemical toxins to enter. These toxins remain in the skin, especially if the body is not able to eliminate it, and eventually collects until the skin becomes overloaded with chemicals. Once these chemicals enter the skin, especially the lead from the paint, they slowly damage the nerves, leading to numbness, or as in the case of Mr. Dimas, total loss of sensation. One of the manifestations of diabetes is poor blood supply to the lower limbs. Poor circulation in these areas makes it prone to infection that usually doesn't easily heal. Because the nerves also gradually get damaged, numbness also gradually sets in. The uncontrolled high blood sugar in diabetes also leads to damages, especially in the linings of blood vessel walls, leading to scar formation and eventually occlusion of the blood vessels, which further decreases the blood flow going to the foot. Poor perfusion to this area will cause tissue damage, affecting the muscles and skin, resulting to dark discoloration. A lot of diabetic patients have problems on the foot because people spend more time standing than sitting or lying down. In standing, circulation is more difficult because gravity pulls down the blood and makes it harder for it to flow back upward, especially if the blood vessels are too weak. Circulation in the lower limbs, therefore, is not continuous. To add to the problem, the person's weight also puts pressure to these blood vessels, causing compression and thus further impairing the circulation. Because of the poor circulation, the toxins that are collected by the blood from different parts of the body for elimination sometimes become trapped in the foot, which is the most dependent portion of the body. The chemical toxins then accumulates, especially at the bottom part of the plantar area, so the tissues surrounding it become damaged, causing numbness, making it easier to ulcerate and decay.
I used to apply a topical preparation recommended by the hospital, but I noticed that the wound is getting bigger. When I return for checkup, they recommend the same thing. I thought that maybe I will just wait for myself to die. So my daughter told me, "Pa, let's go to the program Salamat Doc and check if we can still find a remedy." And so we went. Dr. Delia told me to try Quantumin. I took it orally. I applied it to all affected areas and I used it to cleanse my wound. After about 2 weeks, I felt a big improvement. There was a change. Now I can feel this. Before, this was numb. This wound was so deeply ulcerated. I even thought of putting cement just to level it with the surface. Now you can see that the skin is starting to regenerate.
Quantumin Plus is very helpful for cases like this. First, it contains minerals. One of the minerals that we have enhanced is magnesium. Magnesium will help dilate the blood vessels to improve the circulation of blood throughout the body. The blood will now flow easily, carrying with it cleansers and detoxifiers. The zeolite and the fulvic substance in Quantumin Plus will help gradually remove and chelate the chemical toxins in the body of the patients. Once these patients' toxins are eliminated in the urine, stool, and even in perspiration, because we are also applying it every now and then topically, the patient will now feel more comfortable and more at ease.